let's shift gears. Let's talk about something that's impacting a lot of folks, especially in our newsroom. One person in I should say just one person, but James. I was trying to set you up, but it didn't.
I sneezed like a minute ago, and he almost escorted me out of the room.
We're talking about flu. Flu has been impacting so many people. I'm going to read this blurb from NBC News. So doctor visits like flu for flu-like symptoms like fever, sore throat, extreme fatigue, and body aches have hit the highest levels in nearly 30 years. That's according to the CDC, and are likely to continue to rise in the coming weeks. At least 5,000 people have died this season, including 9 children. So yeah, this is serious stuff here. Bria's here. Bria Smith is here in studio. You're following all the illnesses, respiratory illnesses. What are you hearing, and how's it impacting folks here now, I guess not only in Mecklenburg County, but surrounding areas?
Yeah, definitely. Well, North Carolina and South Carolina, I looked at the map on the CDC of the flu cases, and they are in purple being the highest. So it's actually labeled as very high among, several other states throughout our country that are facing these cases. In North Carolina, just last week, this week, from last week, 25% of cases have increased already. This season, there have been 12 deaths in North Carolina, 16 in South Carolina. So it is very serious. And doctors say, people have that question, then why are these cases increasing so rapidly? And that's because the vaccines are actually created in February of, said year. And so last year, when the vaccine was created for this variant, in July, so in the summer months, is when a mutation was kind of escaped, if you will, for lack of better words, and that is why so many people are now being diagnosed with the flu and things like that, because that vaccine was less effective just because it didn't have time to kind of escape that window. So that's why we're seeing these increasing numbers. But they still say that the vaccine is effective. It will kind of mitigate those symptoms that people are feeling. So definitely get vaccinated if that is your choice. And then also if you are feeling those symptoms and you're just very sick, to kind of stay at home and just practice those, healthy etiquette, sneezing in your elbow, coughing in your elbow, things like that, washing your hands for sure.
Are they seeing less people being vaccinated? Did they mention that at all?
That wasn't a talk. It's just something that they are pushing, though. Okay. But that could also be a factor as to why we're seeing increase, and that's kind of like a common thing where, people who don't get vaccinated, it's obviously, it spreads more. So that does play a factor in the role of the increasing numbers for sure.
I've been seeing quite a few people wearing masks. I haven't seen masks in a few years. You're talking about COVID.
A sight to see.
And I'm like, oh, wow, this is a little PTSD.
But it's kind of normal, though.
Yeah,
I kind of look at people and I'm like, wow, like that used to be our life just a few years ago.
Yeah.
It's something doctors are recommending too. If you're out in public and you feel like you don't want, to get sick, or you can't get sick because you have to be at work, they are asking or, encouraging people to mask up. So kind of stepping back into those kind of COVID-like times.
Oh, man.
Kind of jump when someone sneezes like James over there.
I'm sorry.
And he sneezed right before we got to Bria.
Right before this conversation.
Some good advice there, Bria.